Let's talk about eczema because it does not look the same in all skin tones. Eczema is a chronic inflammatory condition of the skin. At its core, it's a combination of damaged skin barrier, inflammation, and intense itching. In lighter skin tones, eczema often looks red. But in melanated skin, it may look dark brown or ashy, which is why many patients are told they just have dry skin. The itch is not minor. Scratching creates more inflammation, which then leads to dark marks that can last for months after the rash improves. Another important point is that eczema is not just a childhood condition. Several studies show that eczema is actually more prevalent in Black and Asian patients compared to Caucasian patients, and many adults continue to flare. Common triggers include stress, weather changes, fragrances, harsh soaps, and overwashing. Moisturizers are important, but they don't treat inflammation. Treatment often includes topical corticosteroids, non-steroid anti-inflammatory creams, and in some cases, oral or injectable medications. If you're constantly itchy, flaring, or developing thickened or darkened patches, it's time to see a dermatologist. Flaking on the scalp, eyebrows, or around the nose is not always dry skin. Seborrheic dermatitis is a chronic inflammatory condition caused by overreaction to yeast that naturally lives on the skin. It commonly affects the scalp, hairline, eyebrows, ears, and the folds around the nose. It can flare with stress, cold weather, and is a recurrent condition, meaning it requires ongoing treatment. In darker skin tones, seborrheic dermatitis doesn't always look red. Lesions can present as light or dark patches and are almost always scaly. Many patients who notice scalp scaling are told, just oil your scalp. But oils can actually feed the yeast that drives seborrheic dermatitis and can make symptoms worse. A key part of treatment is washing the scalp at least once weekly with an anti-yeast shampoo. Consistent cleansing is essential for control. Razor bumps are not just a cosmetic issue, they're a chronic inflammatory condition. Pseudofolliculitis barbae, otherwise known as PFB, happens when tightly curled hair grows back into the skin after shaving, triggering bumps and inflammation. 85% of African American men experience razor bumps at some point. Shaving too close or shaving against the grain significantly increases the risk of PFB. Over time, chronic inflammation can lead to dark marks, thickened skin, and permanent scarring. The only true cure is to stop shaving altogether and grow a beard. Bumps may be minimized by switching to use of clippers. Most of our treatments focus on control, not cure. Calming inflammation, preventing ingrown hairs, and protecting the skin. In some patients, laser hair removal can be very effective in reducing ingrown hairs and improving chronic razor bumps. Not all dark patches are the same, and melasma behaves very differently than other forms of pigmentation. Melasma is a chronic pigment disorder driven by hormones, sun exposure, and genetics. It typically appears as symmetric patches on the cheeks, forehead, upper lip, or jawline. Unlike post-inflammatory hyperpigmentation, melasma is not caused by injury or acne. It is caused by overactive pigment cells. Another common misconception is that melasma can be cured. In reality, melasma is managed, not cured. And without ongoing treatment, it almost always comes back. That's why daily sunscreen, especially tinted mineral sunscreen, is the foundation of treatment even for darker skin tones. Additional treatments may include topical medications, chemical peels, and in select cases, the careful use of lasers. The goal is gradual improvement, pigment control, and long-term maintenance, not aggressive treatments that can actually worsen melasma. This is the #1 cause of hair loss worldwide, and most people don't even realize it. Androgenetic alopecia is the most common cause of hair thinning worldwide, and it affects both men and women. You may also hear it called male or female pattern hair loss. This type of hair loss is driven by genetics, hormones, and it leads to gradual miniaturization of the hair follicles over time. In women, It often shows up as widening parts, decreased density at the crown, or increased scalp visibility. Because this process is slow, many patients don't notice it until a significant amount of density has already been lost. Minoxidil is the primary treatment option for androgenetic alopecia. However, many patients struggle with the fact that minoxidil requires long-term use. It's important to know there is no cure for androgenetic hair loss. The goal is slowing progression and preserving density. Hair loss is much easier to slow down than it is to reverse. Your favorite hairstyle may be destroying your hairline, and here's what you can do about it. Traction alopecia is hair loss caused by chronic tension on the hair follicles. It most commonly affects the temples, edges, and hairline, and is often linked to tight braids, ponytails, tight locks, weaves, and extensions. The early phase of traction alopecia is reversible, but when excessive traction continues for long periods of time, inflammation leads to scarring, and that hair loss becomes permanent. High-risk hairstyles include tight buns or ponytails, braids or weaves when they are used on relaxed hair, hair extensions when applied to relaxed hair, and any style that causes pain, stinging, crusting, or bumps. To protect your edges, use low-risk hairstyles, loose ponytails, two-strand twists, flat twists, and wash and goes. Take breaks between braided or sewn-in styles. Rotate hairstyles and avoid frequent tight updos. Treatment focuses on calming inflammation and preserving follicles and may include topical steroids, steroid injections, platelet-rich plasma, lasers in combination with growth factors, and in some cases, hair transplantation once the condition is inactive. The most common form of hair loss in Black women that no one is talking about. Hair loss that starts at the crown should never be ignored. Central centrifugal cicatricial alopecia, also known as CCCA, is the most common form of hair loss in Black women. It often begins silently with thinning, tenderness, itching, or breakage at the crown of the scalp. Because it's a scarring alopecia, once hair follicles are destroyed, hair regrowth can be very difficult. That's why early diagnosis is critical. CCCA is not caused by one single factor. Genetics, inflammation, and hair care practices all play a role. Our treatment focuses on addressing inflammation and preserving remaining hair follicles. If you notice thinning in the crown, don't wait. Early care can change the outcome. You've been suffering in silence with this, and it's not your fault. Painful, recurrent bumps in the underarms, groin, or under the breasts are not normal. Hidradenitis suppurativa, also called HS, is a chronic inflammatory condition. It is not an infection, and it is not caused by poor hygiene. HS often starts as tender bumps that can rupture, drain, and heal slowly. Over time, it can leave scars or tunnels under the skin, which can be painful and life-altering. One of the biggest myths that I hear is that these are just boils or ingrown hairs. They are not. HS is a disease process, which is why bumps keep coming back in the same areas. There are important patterns to know. Women are about 3 times more likely to have HS than men, but men can be affected. People who are Black or biracial are more commonly affected. About 30% of patients who have HS have a family history. HS often starts after puberty, but it can also begin later in life. Another major myth is that nothing can be done. That's not true. HS is treatable, and treatment depends on the stage of the disease. Options may include topical treatments such as medicated washes and topical antibiotics. For more advanced disease, systemic medications, including injectable anti-inflammatory therapies, may be needed. In some cases, procedures are used to manage specific areas. The biggest myth of all is that you should just deal with it. You should not suffer. There are treatment options available. Laser treatments can be intimidating, but not all lasers are aggressive. LaserMD Ultra is a non-ablative laser that creates microscopic channels, allowing for delivery of brightening serums in the skin without overheating the surface. This allows for improved skin tone, texture, and pigmentation while maintaining safety in skin of color. One of its biggest advantages is enhanced delivery of topical treatments into the skin. Keralase uses the same technology on the scalp. By creating microchannels, it allows growth-supporting serums to penetrate deeper into the scalp where hair follicles live, thus encouraging hair growth. This can be helpful for patients experiencing early hair thinning or shedding. LaserMD and Keralase are not replacements for medical treatment, but they can be powerful additional treatments. Chemical peels are one of the most misunderstood treatments, especially for skin of color. A properly selected peel does not damage melanated skin. In fact, when done correctly, peels can significantly improve acne, texture, and hyperpigmentation. VI peels are medical-grade chemical peels designed to be safe across a wide range of skin tones. They work by exfoliating the skin in a controlled way, stimulating cell turnover, and improving pigment irregularities over time. Peels are not instant fixes. They require proper preparation, appropriate peel selection, and strict post-care. Another misconception is that peels are only for the face. Areas on the body like the chest, back, underarms may respond beautifully when treated correctly. Downtime varies depending upon the peel, and peeling does not always mean better results. Customization and aftercare are what make peels safe and effective for skin of color. Here's what to expect with microneedling and PRP. Microneedling is about collagen stimulation, not overnight transformation. Microneedling uses sterile needles to create controlled microinjuries in the skin. This triggers your body's natural healing response and increases collagen production. When combined with PRP, platelet-rich plasma, we can enhance healing and improve results. PRP contains growth factors derived from your own blood, which support tissue repair and regeneration. This treatment can improve acne scars, texture, fine lines, and uneven skin tone. Results are gradual and build over time. Most patients need a series of treatments. Technique matters, depth matters, experience matters, especially in skin of color. When done improperly, microneedling can worsen hyperpigmentation. When done correctly, it can be one of the safest collagen-stimulating treatments for skin of color. Let's talk about laser hair removal, because not all lasers are safe for all skin tones. Laser hair removal works by targeting pigment in the hair follicle. That means the laser must be powerful enough to treat the hair, but controlled enough to protect the surrounding skin. In darker skin tones, the pigment in the skin can compete with the pigment in the hair. When the wrong laser is used, this can lead to burns, blistering, or long-term hyperpigmentation. That is why device choice matters. When done correctly, laser hair removal is safe and effective for skin of color and can significantly improve conditions like razor bumps, ingrown hairs, and facial hair in women. Another important point, laser hair removal is not one and done. Hair grows in cycles, and only hairs in the active growth phase can be treated. Most patients need multiple sessions spaced weeks apart. Maintenance treatments are also required. Laser hair removal reduces hair growth. It does not guarantee complete removal. Always ask what laser is being used and why it's appropriate for your skin tone.